Sexually transmitted diseases, STDs, also known as sexually transmitted infections, STIs, are infections that are spread through sexual contact. There are various types of STDs caused by different pathogens. Here are some common types of STDs. Chlamydia, gonorrhea, syphilis, human papillomavirus, HPV, infection, herpes, human immunodeficiency virus, HIV, infection, hepatitis B, trichomoniasis, pubic lice, crabs, bacterial vaginosis, BV. Chlamydia. Signs and symptoms. Many people with chlamydia have no symptoms. When present, symptoms can include abnormal discharge, burning sensation during urination, and pain or swelling in the testicles, in males. Caused by the bacterium Chlamydia trachomatis. Transmission. It can be transmitted through vaginal, anal, or oral sex, as well as from mother to child during childbirth. Risks. Untreated chlamydia can lead to complications such as pelvic inflammatory disease, PID, infertility, and increased risk of ectopic pregnancy. Diagnosis. Diagnosis is typically done through urine tests or swabs from the affected area. Gonorrhea. Signs and symptoms. Common symptoms include increased vaginal discharge, pain or burning during urination, and pain or swelling in the testicles, in males. Caused by the bacterium Neisseria gonorrhoeae. Transmission. It can be transmitted through vaginal, anal, or oral sex, as well as from mother to child during childbirth. Risks. Untreated gonorrhea can lead to complications such as PID, infertility, and an increased risk of HIV transmission. Diagnosis. Diagnosis is usually done through urine tests, swabs from the affected area, or blood tests. Syphilis. Signs and symptoms. Syphilis progresses through different stages. Primary syphilis is characterized by a painless sore, chancre. Secondary syphilis may involve a rash, flu-like symptoms, and swollen lymph nodes. Tertiary syphilis can affect the heart, brain, and other organs. Caused by the bacterium Treponema pallidum. Transmission. It is primarily transmitted through sexual contact, including vaginal, anal, or oral sex. It can also be transmitted from mother to child during pregnancy or childbirth. Risks. Untreated syphilis can lead to severe complications, including neurosyphilis, cardiovascular syphilis, and damage to multiple organs. Diagnosis. Diagnosis is usually done through blood tests. Human papillomavirus, HPV, infection. Some high-risk strains can cause genital warts. Certain strains of HPV can lead to cervical, anal, and oral cancers. Caused by the human papillomavirus. Transmission. It is transmitted through vaginal, anal, or oral sex, as well as through skin-to-skin contact. Risks. Persistent infection with high-risk HPV strains increases the risk of developing cancer. Diagnosis. Diagnosis is usually done through physical examination, Pap tests, and HPV DNA tests. Herpes. Signs and symptoms. Herpes can cause painful sores or blisters on the genitals or mouth. Some people may also experience flu-like symptoms during initial outbreaks. Caused by the herpes simplex virus, HSV, specifically HSV1 and HSV2. Transmission. It can be transmitted through direct contact with the infected area during sexual activity or through oral to genital contact. Risks. Recurrent outbreaks can occur, and the virus can be transmitted even when no symptoms are present. Diagnosis. Diagnosis is usually done through visual examination of the sores and laboratory tests such as viral culture or polymerase chain reaction, PCR, tests. Human immunodeficiency virus, HIV, infection. Signs and symptoms. In the early stages, HIV infection may cause flu-like symptoms. Caused by the human immunodeficiency virus. Transmission. It is primarily transmitted through sexual contact, sharing needles, or from mother to child during childbirth or breastfeeding. It can also be transmitted through blood transfusions or organ transplants, rare in developed countries. Risks. HIV weakens the immune system and can lead to acquired immunodeficiency syndrome, AIDS, if left untreated. Diagnosis. Diagnosis is done through blood tests that detect antibodies or antigens related to HIV. Hepatitis B, S. SGNs and symptoms. Symptoms can include fatigue, abdominal pain, jaundice, yellowing of the skin and eyes, dark urine, and loss of appetite. Many infected individuals may remain asymptomatic. Caused by the hepatitis B virus. Transmission. It can be transmitted through sexual contact, sharing needles, exposure to infected blood, or from mother to child during childbirth. Risks. Chronic hepatitis B infection can lead to liver cirrhosis, liver failure, or liver cancer. Diagnosis. Diagnosis is usually done through blood tests that detect hepatitis B antigens and antibodies. Trichomoniasis. Signs and symptoms. Symptoms may include itching, irritation, redness, and discharge from the genitals. Men with trichomoniasis may experience irritation inside the penis, mild discharge, or burning after ejaculation or urination. Caused by the parasite Trichomonas vaginalis. Transmission. It is primarily transmitted through sexual contact, including vaginal intercourse. Risks. Trichomoniasis increases the risk of acquiring or transmitting other STDs. Diagnosis. Diagnosis is usually done through a physical examination, microscopic examination of the discharge, or laboratory tests. Pubic lice, crabs. Signs and symptoms. Symptoms can include itching in the pubic hair area and the presence of lice or their eggs, nits, on the hair shafts. Caused by the parasitic insects called pubic lice. Transmission. It is primarily transmitted through close physical contact, including sexual contact. Risks. Pubic lice infestation can cause secondary bacterial infections and skin irritation. Diagnosis. Diagnosis is usually done through visual examination of the lice or their eggs. Bacterial vaginosis, BV. Signs and symptoms. The most common symptom of BV is a fishy odor, often accompanied by a thin, grayish-white vaginal discharge. Some women may also experience itching or irritation in the vaginal area. Cause. BV occurs when there is an imbalance in the normal bacteria in the vagina. Transmission. BV is not considered a sexually transmitted infection, STI, although sexual activity can disrupt the balance of vaginal bacteria and increase the risk of developing BV. However, it can occur in women who are not sexually active as well. Risks. Certain factors can increase the risk of developing BV, including multiple sexual partners, douching, using intrauterine devices, IUDs, and smoking. Diagnosis. Diagnosis is usually based on a combination of symptoms, a physical examination, and laboratory tests. Thank you.